Welcome back to Pain-Free Living. Again, Dr. Andrew Gorecki, physical therapist, owner of Superior Physical Therapy. And reminder, today we're talking about knee pain, and I'm trying to help you come up with a natural solution so you can avoid medications, injections, and surgery, and allow your body to do what it was born to do, which is heal itself. That's important. That's an important idea there. The body is designed to heal itself naturally, but you have to create the right environment. The right environment needs to include sleep, nutrition, and also the physical environment. The physical environment needs to be healthy so that it's not damaging the knee constantly. So really that's what we're talking about today, is the physical environment. So in this segment, I want to kind of hit quickly on the two most common names or diagnoses of knee pain, so that you can kind of understand and maybe put yourself in one of those categories. By far, the two most common names are, number one is osteoarthritis, okay? Arthritis, maybe it also has names called joint space narrowing or joint degeneration. Cartilage wearing out, bone on bone is one I hear a lot. And really, what does that mean? So arthritis of the knee or the joints and the bones, it's really a natural aging process. And in the next segment, we're actually going to talk about two studies, one particularly that basically shows that it's pretty hard to find anybody over the age of 50 without arthritis in their knee. Now the question is whether or not they have pain. I don't want to ruin it for us too early here, but stay tuned to the next segment. But really, arthritis is essentially the aging of the bone. So think of your skin, right? Your skin at 25 and then your skin at 75, right? The skin changes, it becomes a little bit wrinkly, maybe not so thick, a little bit more sensitive. And the idea is the same things are happening with our bones. And so it's important to recognize that it is really natural aging. The bone changes, the joint space does narrow. The joint space narrows in all of our joints, by the way, as we age. It's the reason why we shrink, most commonly in the spine. Our spine is actually losing joint space in the disc area. And so it's happening all over our body. But by far the most common diagnosis of knee pain is arthritis. Now we'll get to that in a minute. Later on, what do we do about it, right? Can you live without arthritis pain? Yes, you can. And now the second most common name or diagnosis of knee pain is what's called a meniscus tear. And as you can see in this image here, a meniscus is this little, as the bones come together to create that joint space, a meniscus is this little, almost like a cartilage ring that goes around the knee joint. And really the point of the meniscus is to make it so that the knee joint itself is more congruent, or maybe more stable, so that the knee joint is maybe held together better. Some people like to refer to the meniscus as a shock absorber. I would say that there's not a lot of evidence to support that. In fact, there's a lot of evidence to support that the knee joints themselves the bones aren't actually touching. There's space in between those bones, and that's a good thing. There isn't a structure on the earth that can be slammed into each other 10,000 times a day like you do when you're walking with about 1,000 pounds of force that wouldn't be completely destroyed. So our bones don't touch, there's a space in between, and it's our muscles and our soft tissues' job to keep that joint space open and transmit the energy elsewhere. So you've got two types, osteoarthritis and a meniscus tear. Now, again, next segment we're going to talk about the meniscus tear and does that equal pain? And there's different grades of meniscus tears, and I can say that it's natural for us to have some minor tearing. On the other end of the spectrum, we can have a meniscus tear that's so bad that it actually gets inside the joint and stops the knee from moving, where it locks up. In those cases, that is definitely a surgical situation where the knee is locked up and cannot move. For everybody else, there's a lot of hope. So we're going to dive deep in the next segment to discussing what really goes wrong that is actually causing the knee pain. Because we know that the osteoarthritis and the meniscus tear actually are not the reason why we have pain. They're just diagnoses that we find on an image. So that's an important thing, and we'll get to that next when we talk about the studies. And so if you're looking for a natural solution to knee pain, I would encourage you to give us a call at Superior Physical Therapy. We have knee pain experts waiting to speak with you. Simply call 231-421-9300 and we will set up a consultation.